Hi, I'm Dr. John Young, medical doctor.
Hi, I'm Alex. I'm a nurse practitioner.
And Alex and I practice together here at Foundational Health Center in St. Petersburg, Florida. One of the things that we see a lot in our practice is we see a lot of women and men also coming in complaining of hormonal issues. And I think it's been very interesting, Alex, that in the last probably 10, 12 years, ever since the reports came out that Premarin, that estrogen that all women were on for years and years and years, does make breast cancer worse or causes more incidence of breast cancer, that everybody has just been, we aren't going to do anything with hormones.
Yes.
And then, of course, they're sitting in front of us saying, John, I have hot flashes, vaginal dryness. They say my bones are terrible. I'm going crazy. I can't sleep. My husband's upset because I have no sex drive. And the guy's saying, and I have no testosterone. But we've been afraid to do anything with the hormones just because of that increased cancer risk.
Yeah.
And what we've seen over the years is there are great alternatives.
Yes.
We use a lot of bioidentical because, I think it's very easy, and I've often said to some of my patients, so your gynecologist said, we'll just get used to it.
Yeah.
I said, was your gynecologist under 30 years of age?
Sometimes, yes.
So there are things that you can do, we do in our practice every day.
Yeah.
When it comes to hormones, that you can really change a person's life and not have to worry about, am I going to get cancer?
Right. And I get that question all the time because when you mention the prescription estrogen hormone, yes, it's true about the fact that estrogen prescription hormone can be bad for you because it's a synthetic hormone. So we get this question all the time, and that's what the studies show. So the studies were done with synthetic estrogen. So we don't do that. We do bioidentical replacement hormone therapy. But you made a good point about people don't feel well. Women don't feel well. They're not feeling good when they go through menopause, or sometimes younger than that. So I like to separate in two groups, the perimenopausal women and the postmenopausal women, because the treatment will be different, different treatments for different groups of patients. But yes, there are things that can be done. There are hormone replacements that we can do to alleviate some of the symptoms that you mentioned. Hot flashes, it can be very uncomfortable when you're going through that period. But a lot of the fear out there has to do with breast cancer. And
Right.
That's where our practice, we focus on preventive medicine. So before we even put anybody on hormones, we're looking at other things. We're making sure that the inflammation, we're looking at inflammation levels, we're looking at vitamin D levels, we're looking at mitochondrial problems. So we want to make sure that the body that's going to be receiving the hormones, it's a good body, it's in a good condition, it's in good shape.
So what would be the basic labs you would order?
Okay, so that's a good question. It's a lot of practitioners like to order either a urine test or a saliva test. We do blood test, and we have our own way of looking at this test. So we don't look with the same eyes that your gynecologist will look at the test. But we like to do a blood test. So basically what we like to do is, if you're still having a period every month, we like to do a 21st day of your period. So there's a timing also involved with this. We have to do the right timing so we know what's happening. So we do a blood test. We can also do a urine test. It's not commonly ordered. We don't also do that all the time, but we could do that too.
So how would I even know, or does a patient come in just saying, I've got hormonal problems? Or what are some signs that a woman and a guy may be having some hormonal problems?
So usually people come in and they say, I don't know what's going on with me, but something has changed. I'm not the same person that I used to be. I'm tired, my energy is low, I can't sleep well, I just feel different. There's something about my, usually start with energy. A lot of people get low energy. So there's a shift in hormones that happens through a lifetime, and it usually starts at age of 35. So we always take that into account. You see, now it's not necessarily true that every single time is a hormone problem. Could be some other problem, but usually people they sometimes don't know how to express, but something's different about me.
So what would be some typical hormone, something's changing hormonally? Would it be hair loss or?
Would be for women, would be the very first thing that women notice is weight gain. So weight gain, then the next thing would be hot flashes, memory, a lot of memory problems. Hair loss, yes, can happen, but a lot of women tell me the thinning of the hair, my hair is not as thick, it's not as full, so that's another change. And dry skin, women don't like dry skin. If they start having dry skin, they're like, I don't know, 3 months ago my skin was good, now it's very dry. So for men, I think you see a lot of your our patients with testosterone problems. What would you say would be?
Well, I will have the woman many times with the husband saying,
Yeah.
Listen, sexually he's not like he used to be.
Yeah,
You
so
know?
the low libido, right?
So low libido can be there. Also the ability to sustain an erection.
Yeah.
Weight gain.
Yes, weight
Weight gain,
gain.
one.
Yeah, and abdominal fat.
And abdominal fat.
Yeah.
Yes.
So those are correlated, and it's important to bring those things up to your doctor. So instead of prescribing a prescription drug for, Cialis, or maybe we can just do testosterone, which you need that anyway. So men need your testosterone level to be optimal anyways.
I think it's very interesting. There's been some interesting studies done with testosterone, and even women need testosterone. And I think it was the American Journal of Cardiology a number of years ago said this: if the testosterone level gets too low, it affects the heart.
Yes.
Because what organ in the body, both male and female, uses the most testosterone?
The heart. Yeah, the heart.
And it's not the vagina or the
Yeah.
penis.
Yeah,
It's the heart. And so all my patients that have gone into congestive heart failure, they all had low testosterone.
Yes.
Male and female.
Male and female.
So I like to check testosterone levels.
Yes,
I'll
okay.
speak for men for a second. But realizing this, that in a lot of the labs, the normal range for testosterone is 250 to 970.
Mm-hmm.
And I have people that come in and they're coming in with some other things, but they'd like to know what their testosterone is. And it's maybe 260. And they are like Don Juan.
Yeah.
I mean, a little crazy sexually.
Mm-hmm.
And I have people, their level is 700, and the most beautiful woman in the world can come by and they wouldn't even notice her. It's a bell curve.
Yes.
And when people say, oh, you're fine, you're 1 point within the normal, that means nothing.
Yes.
It's a range, and you have, as a physicians, in nurse practitioners, that's what we look at, is maybe you need more than the average person before you're optimized.
It's very important what you're saying, which means you have to do a correlation with the patient sitting in front of you. That's that person. You're treating that person, you're not treating statistically, looking at the whole population. So, but one thing that I noticed that I do for my female patients is I also order insulin, a fasting insulin level. I always do that for my female patients. And let me tell you, I don't see that being done in other practices, but I see a correlation between high insulin levels and low progesterone levels. And that can affect women at all ages, from the age of 12 years old all the way up to menopause or premenopause. So the insulin levels should be tested for women because it can lower their progesterone levels.
And I also check it for men because insulin binds hormones, even testosterone. So we're going to be doing a little series here on hormones, and we just talked a little bit about testosterone, but in our next get together, we're going to be going into depth with estrogen and progesterone. So until next time, have a good day.